Good afternoon, everyone. My name is Andra Gillespie. I'm the director of the James Weldon Johnson Institute. And on behalf of the staff and the visiting fellows of JWJI, I'd like to welcome you to today's Race and Difference Colloquium session. Before I begin today's meeting, I do want to acknowledge that this time last week when we were meeting, there were 8 members of our community in Ackworth and just on the edge of Buckhead, about 15 minutes away from our campus, who are alive and contributing to our community. As we know from the work that our fellows and our presenters in this colloquium series do, their lives were circumscribed by race and gender, a labor market, a popular culture that drive Asian women disproportionately to the service sector, where stereotypes about hypersexuality subject them to sexist and misogynist stereotyping, and a historical moment where we've seen an exponential increase in hate crimes against Asian Americans related to the pandemic, fomented by racist scapegoating that extended from the White House to the grassroots. So unfortunately, what happened last Tuesday didn't necessarily surprise us, and we stand in solidarity with our Asian American and Pacific Islander community, and we stand against hate, and we commit our research resources to helping to aid in that struggle. So you please take a few seconds with me to acknowledge the victims and the hate that swirls around us as we commit to do better. Thank you. Today we have the pleasure of talking a little bit about what the post-pandemic world will look like. And to do that, we're honored to have Dr. Craig Watkins with us. As Craig Watkins is the Ernest A. Sharp Centennial Professor at the University of Texas at Austin. He is an internationally recognized expert in race and digital media studies. He's the author of 6 books. His 2 most recent are called The Digital Edge and Don't Knock the Hustle. And they're based on research he did as part of a research network funded by the MacArthur Foundation. He's currently the founding director of the Institute for Media Innovation at UT Austin, a research and design hub in the Moody College of Communication that focuses on racial equity and artificial intelligence and the social and mental health impacts of COVID-19. So without further ado, please join me in welcoming Dr. Craig Watkins.
Thank you, Andrea, for the introduction, and thank you all for coming today. And I echo the sentiments that Andrea expressed earlier in terms of the most recent tragedy here in this country related to systemic racism. I'm going to, let me also just say thank you to Rhonda Patrick for her patience and helping to get me scheduled and here with you today, and looking forward to the opportunity to share some thoughts with you in terms of things that I've been working on, things that I've been thinking about, projects, and just interesting time to reflect on the pandemic world that we're in and sort of projecting forward, thinking about the post-pandemic future. So let me pull up my slides and we will get started. Okay, so this talk is titled Creative Futures, Redesigning Black Lives in a Post-Pandemic World. And I'll talk a bit about kind of my framing and thinking about this notion of creative futures and why I think it will become an important component as we begin to think about what African American life will look like in a post-pandemic future. So this talk, I think I sort of scheduled, we scheduled this talk back in the fall for this date. This was just as our knowledge and understanding of COVID, and more specifically, some of the racial dynamics and dimensions of COVID were becoming more and more clear. So I was sort of anticipating, the opportunity to sort of reflect on COVID-19, the many disruptions that it's caused, financial disruptions, health disruptions, social disruptions, educational disruptions. We could go on and on and on. But it was, certainly anticipating an opportunity to use COVID as yet another moment to reflect on the legacy and the current dilemma of systemic racism in this country. It was right around that time where we were beginning to see, some of the data that was beginning to illustrate that although a pathogen like COVID knows no boundaries, that its impact was quite disparate and disproportionately occurring in lower income communities. African American, Latinx, Native Americans were bearing the brunt of deaths, bearing the brunt of hospitalization, and of course, rates. But for some time, sort of early on through most of the pandemic, right, a lot of this data was not being disaggregated by race, by region, by income, by gender, by education. And slowly, as that data has become more and more clear and available to us, a very stark picture has come into existence for us. And so just think about the death rates as it relates to COVID. And here's a study that was published last year using some of that disaggregated data. But what you see here, right, is where you see my cursor flashing is African Americans making up about 12% of the total US population, but representing over 20% of the deaths related to COVID-19. And if you break that down right across different states, you see a similar kind of trend here. So in Wisconsin, for example, African Americans make up 6.6% of the total population of Wisconsin, and yet represented about 36% of the deaths. And that was the same for most cities across the country, where you saw African Americans, Latinx, for example, again, disproportionately suffering the gravest impacts of this pandemic. Now, we know historically, right, from research by those in public policy, by those in public health, the sociology of health and inequality, that these health outcomes that we see associated with COVID aren't unique, right? Insofar as they are reflective of a longer trend, a longer legacy, if you will, of disparate health outcomes in this country that are shaped in many ways by what researchers refer to as these social determinants. And here are just some of the primary social determinants of health that have been identified over the years by researchers. And of course, as you begin to understand this longer legacy of the disproportionate impacts of health, issues around health equity, the COVID story, right, is one that is consistent with the story that has been evolving for decades, even centuries in this country. Let me just give you one example of how these social determinants of health allow us to better understand, why it is that African Americans, for example, were dying at significantly higher rates compared to their general numbers in the population. And this is some data from an organization called Civic. And this was a piece that was, some of their data was reported on by the New York Times relatively early on in the pandemic. And the sort of orange lines represent lower income populations, lower income areas. The blue lines represent higher income populations, higher income areas. And what this particular piece of data is measuring is movement, right? To what degree, once COVID began to spread in this country, to what degree did lower income people from lower income populations compared to people from higher income populations, to what degree, right, did they begin to essentially start decreasing their movement, essentially, right, decreasing their potential exposure to COVID-19? And what the data showed, this is again fairly early on in the pandemic, is that lower income populations, those again from lower income areas, were less likely to decrease their movement compared to their higher income counterparts. And this data was looked at across many different geographies, many different regions. And again, what you see across all of these, right, is that in the orange line, those in the bottom 10%, versus the blue line, those in the upper 10%, the rate at which they began to decrease their movement, the staying at home, being able to work from home, the rate at which they were able to do that varied significantly across these different populations. And what this reflects more broadly is a circumstance that we have come to understand, is that many lower income people, right, in which African Americans are sort of disproportionately represented in that category are essential workers, right? So they were working in jobs that required them to continue moving, required them to continue showing up in public spaces, grocery stores, medical facilities, other kinds of frontline service-oriented workers, transportation, you name it. And the research has shown, right, that individuals who were classified as essential workers, particularly right at the lower end of that occupational category, were subjected, right, to higher rates of exposure, higher rates of infection, and indeed higher rates of hospitalization and death. And so this is just one example of how these social determinants, right, just these different sort of features of everyday life that sort of shape our conditions, shape our environment, shape our behaviors, shape our life chances, shape our health outcomes, sort of began to give us a better understanding of the ways in which COVID was basically impacting different populations in different kinds of ways based on these circumstances. This all speaks, right, to just the legacy of systemic racism. As this pandemic began to spread across the country, this also happened at a time, right, with the continued murder, if you will, of African Americans by state-sanctioned authorities and officials, law enforcement, more specifically, Breonna Taylor, George Floyd, and this growing sort of public awareness, right, of what we have all known for some time, right, is this legacy of systemic racism. And while as young people were protesting, I'm always sort of mindful of some of the signs that they held up during those protests, including one, right, saying that racism, right, is a pandemic, and the degree to which the illnesses of racism, the spread of racism, begin to undermine the quality of people's lives. And we're even beginning to learn, right, from some of the research of those in the medical sphere, the medical domain, that systemic racism, right, and the stress that comes with systemic racism, financial stress, economic stress, occupational stress, personal stress, familial stress, that these are beginning to sort of impact people, African Americans, even at the biological level, right? And so there's this term called weathering, and the degree to which Blacks, at least some of the research is suggesting, are aging, right, at a much more rapid rate compared to their white counterparts, due in part, many believe, right, to the stresses that are associated with racial discrimination and systemic racism. All that being said, we've had recent state and local governments either pass or consider declarations declaring racism as a public health crisis. And so again, the extent to which these conditions have become more and more aggravated, more and more intensified, continuing, right, to diminish the quality of African Americans' lives, and hence the quality of their life chances. So right around this time, so April, May of last year, I assembled a research team here at the University of Texas and began to start doing interviews with young adults. We were interested in how young people were navigating the circumstances of COVID, the disruptions of COVID, and to get a better sense of their concerns, their anxieties, their hopes, their aspirations, how all of that, right, was being impacted in many different ways by the pandemic. We conducted over about 100 or so depth interviews, and had an opportunity, right, to really hear from a variety of young people all across the country in these depth interviews to learn more about their kind of responses, if you will, to the pandemic. We're still kind of beginning to clean up the data and kind of comb through and preparing data for deeper analyses. But there are a few themes that kind of emerge for us almost immediately. For many young adults that we interviewed, there was this dilemma of many of the jobs that they had access to, right, were oftentimes jobs that required them to expose themselves, right, to COVID-19. Again, either essential jobs or service-oriented jobs that did not allow them to stay at home or work from home, to earn income from home. And so many talked about, right, this sort of tension between, on the one hand, needing to earn income, versus also trying to protect themselves from exposure to COVID-19. As I'll talk about here in a moment, many young people talked about the mental health toll that the pandemic has paid on, cost them. This has to do with a number of different things, right? The degree of social isolation that we all entered into, and the extent to which that sort of just intensified the state of loneliness in this country. And some medical researchers are arguing, have been arguing before COVID, that loneliness is a public health issue in this country as well. And that, of course, has only been magnified and accelerated as a result of the pandemic. Many young African Americans began to, and not only young African Americans, but Latinx and others as well, begin to start expressing concerns about, on the one hand, the need to protect themselves, but also, and this is during a time where there were a number of public demonstrations happening, right? So as you can imagine, many young people feeling compelled to go out and to express their voice, to express their sense of the civic self and their civic agency in the face of systemic racism, in the face of such tragedy that took place, last year in terms of the sort of highly visible deaths of African Americans at the hands of law enforcement. And so these were just some of the things that we began to learn more and more about. But one of the things that struck me, right, is while many young adults expressed similar concerns, there were some concerns that were a bit more salient, I think, for African Americans and their Latinx brothers and sisters. And that is the degree to which, compared to their white counterparts, they did not have the sort of familial resources and access to resources, financial resources, a safe place to stay, for example, allowing them to sort of find a sort of reasonable and comfortable landing spot in the face of this pandemic. And what I mean by that, right, is just simply access to fewer resources to allow them to sort of make it through the sort of storminess of these conditions that were wrought by the pandemic. Not having access to family with financial resources, not having access to family with connections that might enable you to find access to a form of employment that might also allow you to protect yourself via safe and social distancing. And so in this sense, right, beginning to articulate a degree of crises that was even more pronounced than some of their white and more affluent counterparts, suggesting to us, right, that although many young people felt the pain of COVID-19, that pain was not evenly distributed, and some felt it in much more intense, systemic, and sustained ways. And so for many young people, right, sort of as they sort of projected forward and sort of thinking about their futures and thinking about their lives in the face of the pandemic, a lot of uncertainty, a lot of anxiety, hence some of the rising rates of mental health that we began to see, particularly among young people of color, right, in this country. We were just talking earlier before we started here, but concerns about the legacy of COVID-19 and its impact on Black American life. Everything right from education and what the implications are for a generation of African Americans who were already right attending K through 12 institutions that were failing them miserably in terms of delivering high quality education that prepares them for an economy that's rapidly changing and an economy that's requiring very different kinds of skills and competencies and abilities in the face of technological transformation. Of course, right, again, as we've alluded to here already, just the sort of health complications and the toll that is played, both in terms of Black people's sort of physical well-being, but also their mental well-being as well. And so all of this suggests, right, is that the crisis state of African Americans has been worsened in ways that none of us could have imagined. And so what happens, right, when perhaps if not an entire generation has been lost because of educational inadequacies, certainly significant portions of the generation impacted mightily by these inadequate opportunities for learning and preparation for a future economy. And so what I'd like to do in the sort of the final few minutes of my talk, and I do want to leave some time for questions and conversation, is sort of reimagining and redesigning Black lives in a post-pandemic future. And so there are many different domains in which this sort of redesign will be necessary: education, economics, our communities, right? And sort of building communities that can sustain themselves, right, through this crisis. I want to focus on two in particular. One is mental health, and the second one, right, is sort of thinking about just the sustainability of Black lives and the sustainability of Black communities and what we might call Black life chances. To start this work, and again, this notion of creative futures, which I've been dealing with in my own research and in my own thinking, and I'll get to what I mean by that here in a moment. But part of what I'm basing this talk and my argument around is that it's going to take ingenuity, right, to sort of figure out the best ways to enhance the quality of Black people's lives. It's going to take ingenuity to think about how to grapple with the damages caused by COVID, be they educational damages, be they occupational damages, be they economic damages, familial damages, health damages. That the old solutions, right, that the conventional solutions that have oftentimes been tried in the past will likely need updating, modification, or completely a new redesign and re-engineering. And I want to give some thoughts about that here today. I want to preface this or frame this within the context of, again, a world, a society, and an economy that's changing, rapidly, and has been changing rapidly for the last 30 to 40 years, with the computerization of the world, and the increasing role that technology systems, data-driven systems are beginning to occupy in our world. And some of this thinking, right, was informed by some of the work done by Frank Levy and Richard Murnane. And this book was published 20 years ago, right? And again, these conversations have been taking place for some time. And yet our ability to respond to these changing conditions have been slow to occur. But part of what they argue in the book is that the arrival of computers, the computerization of work, the computerization of labor, the computerization of our society and our economy has had a significant impact, right, on the division of labor, a significant impact on people's opportunities to find meaningful and sustaining employment in this new economy. And so this new upheaval sort of brought about by these new technology systems has created what they call a new division of labor. And part of what they argue, right, and they're being somewhat facetious in the argument, or at least my interpretation on being somewhat facetious in terms of the argument that they're making, but in some ways they sort of split the world in two. Right? On the one hand, you have those who have developed the skills, the capacity, the competency to be able to work with technology systems, to work with computers, to work with these new updated platforms. And so their skills become a complement, if you will, to technology. They contrast that group of workers to the other group of workers and those whose skills, right, are increasingly being replaced and substituted by technology. So this idea, right, that people are being increasingly displaced, people are being increasingly forced out of the labor market due to the increased and enhanced capacity of computers, smart machines, robots, for instance. And the argument, right, is that those who have the skills to complement these technologies are much more likely to find opportunity than those whose skills are being substituted by the technology. And so this has led to a number of different sort of popular culture observations and discourse around this new economy, around the rise of the robots. And in my own work, I've been thinking about, the sort of racial and class implications of these trends, which oftentimes get sort of marginalized in these conversations. They don't register as pronounced, in the conversation or in the discourse. But what I'm getting at, right, is who's being displaced, who's being rendered obsolete, who in effect is being disempowered by these new technology systems, who's most likely to gain or win in this new economy, who's most likely to lose or fall behind in this new economy. And part of my work is either explicitly or implicitly sort of engage this question. And the argument, right, is that on the one hand, computers, automation, smart technology, robots will lead to a jobless future, right? A future in which there will be less and less work for people to do, particularly right for those who find themselves on the lower end of the skill continuum, versus the creative future, that is to say, those who have the skills, those who have the capacity, those who are equipped right with the cognitive and creative ability to sort of navigate these systems, to ask new questions, to sort of think of and invent new things to do, new tasks to be accomplished, new industries and new jobs to be created. The idea, right, is that who's most likely to occupy, right, that position, to sort of, be in that domain. And when we begin to think about it, right, it certainly develops some very striking, racial and ethnic and sort of gender characteristics in terms of who we see in this new economy thriving and finding opportunity, and who we see being rendered increasingly marginal in this new economy and lacking access to opportunity. So as we've been thinking about the racial dynamics and the racial dimensions of these technology systems, research is beginning to reveal a number of interesting challenges and problems that suggest, right, that systemic racism is continuing to manifest itself in this new technology world that we find ourselves becoming more deeply and deeply, embedded in and sort of implicated in. If it's thinking about the work of Sophia Noble, for example, and what she refers to as algorithms of oppression, and the degrees to which algorithmic decision-making function in ways that replicate age-old systems of discrimination, age-old systems of ranking and sorting Black and lower income people, right, in less advantageous sort of positions and orders. We're beginning to see, for example, how the deployment of new technologies, be it artificial intelligence, be it social media, be it data analytics, big data systems, the ways in which these kinds of approaches to technology and expressions of technology are reflected in what's called predictive policing. And the rise of this sort of surveillance state, the ability, right, to watch, observe, and try to identify and predict where crime is likely to happen, who's most likely to commit a crime, and how resources are allocated as a way of responding to that. And what we're learning, right, is that those systems are oftentimes predicated on historical forms of data, right, that have oftentimes come at the price of Black lives, have come at the quality of Black lives. And so it ends up this sort of vicious sort of feedback loop, where because Blacks have been suspected of criminal activity, because Blacks have oftentimes been associated with certain types of criminal activities, these systems sort of predict and project them as future criminals, and therefore subjecting them to enhance and intensify forms of policing. We're also seeing, right, how these systems are sort of undermining equity in the criminal justice system, and the ways in which racism rather is beginning to influence facial recognition software and systems as well, to the point where, as a result of increased protests by technology activists, by community activists, more and more organizations, Microsoft, Amazon, for example, as well as local police departments around the country, have been forced to acknowledge that facial recognition is a significantly flawed technology, and one that is disproportionately more likely to misidentify African Americans, particularly Black women, to some degree Black men as well, and therefore being less of a reliable tool in terms of enhancing law enforcement practices. And I'll move quickly through this, but a lot of this has to do with what's oftentimes referred to as the black box phenomenon. This idea that most of us have no idea of how Facebook algorithm makes its decisions, how YouTube makes its decisions, how any big social platform or technology of any kind really makes its decisions. It's this idea, right, that these algorithms, these automated decision-making processes are hidden, they're secret, they're proprietary, and therefore we have no access, right, to what's going into that black box in terms of what kind of data is going into that black box, the kinds of machinations that these algorithms are then going through, and then the kind of outputs, the decisions that are made. And what we're beginning to understand, right, is that oftentimes those decisions, right, again, are replicating racial and gender bias in some striking and significant ways. New York Times reported, I think around this time last year, January or so of last year, if I'm not mistaken, that in Detroit, an African American man was misidentified by facial recognition software, and may have been the first known case where police using this type of software wrongly identified someone, went to his home, arrested him in front of his mother and daughter, and ended up having to apologize because he had been misidentified by the software itself. In my own work, I've been thinking about these issues either directly or indirectly in terms of the digital edge. I had a research team a few years ago that spent about a year and a half in a high school, and we were interested in a lot of things. But for example, one of the things that we were interested in is to what degree are schools adequately designed and equipped to help young people develop the kinds of skills and literacies that allow them to navigate this new economy, that allow them to participate in this creative future. And not surprisingly, right, what we found is a phenomenon that we and other researchers refer to as classrooms that are increasingly technology rich, but curriculum poor. And what we mean by that, right, is that even as more and more technology has come into schools and come into classrooms, even in schools and classrooms that are being populated by African American and Latinx, for example, that oftentimes students are not given access to curricula or given access to learning opportunities that allow them to cultivate the kinds of interests and skills that might better prepare them for a new economic future. And then Don't Knock the Hustle, which is kind of a follow-up to that work. I was interested in a lot of things in this research, where we just began to start interviewing and observing and talking to what I call young creatives. But I began to ask the question after writing The Digital Edge: if our schools aren't preparing young people with the skills that they need to go out and find and create their own opportunity in this new economy, where do young people go to learn those skills? And how do they learn them in the face of these educational inadequacies? And what we began to understand here is that if it's in the civic realm, if it's in the creative realm, the media realm, the educational realm, that young creatives are beginning to mobilize their resources, are beginning to mobilize technology in ways that enable them to deliver opportunities and to create opportunities, even in the face of the challenges that we face in our educational system. So designing spaces for young people to come and to work together to solve problems, if that's via community-based hackathons, if that's using Twitter and social media as Issa Rae did with Awkward Black Girl, sort of using YouTube and using social media as a way to find and build Black community, to enable Black voices and Black storytelling in the face of an industry that was oftentimes denying young African Americans access to those resources. And so it's this idea, right, that young people are creating new kinds of innovation economies, creating new kinds of innovation futures, and how do we as a society further support and enable and facilitate them to continue doing that, and even expanding and scaling the work that they're doing. And then finally, right, some of the work that I've been doing, and I'll conclude here, at the University of Texas at Austin, we have this campus-wide initiative called Good Systems. And Good Systems in some ways, right, if we were to translate that, it might sort of be read as ethical artificial intelligence. As we think about, right, the ways in which AI continue to produce these kinds of discriminatory outcomes and impacts, some of which I alluded to earlier, the question becomes, how can we leverage technology systems to advance rather than undermine racial equity? And so this is something that's become kind of a sort of a focal area of interest for me, in terms of not only thinking critically about the technology, but also thinking creatively about how we might be able to redesign or re-engineer or rethink the technology in ways that address some of these racial equity gaps that I've alluded to. And one is mental health. And so what we've learned from COVID, for example, is that, again, the impacts have been striking. They've been varied and multiple and complex. But in terms of mental health, right, if you look at some of the work that the CDC has been doing, for instance, we've seen these really interesting trends in which young adults are self-reporting significantly higher rates of mental illness, anxiety, depression, for example, suicidal ideation. People of color, right? There has been this sort of historic myth, if you will, that mental illness, right, is a white person thing, right, and that people of color, and African Americans in particular, are less prone or less vulnerable to these kinds of conditions. And recent data trends suggest quite the contrary. In fact, we know that if you look at those at ages, let's say 18 and younger, that the rates of mental illness amongst those 18 years old and younger are increasing significantly at higher rates for people of color than they are their white counterparts. We know, for example, that Black children, I think between the ages of like 6 and 12, are significantly more likely to commit suicide than their white counterparts. And so this notion, right, that mental health and mental illness is something that are becoming more and more pronounced in communities of color is something that that our communities are being forced to grapple with one way or another. And then I mentioned earlier the degree to which those who find themselves classified or engaged in essential work are also expressing higher rates of mental illness too. And again, here are just some recent numbers. But what you see, right, is that the prevalence of mental illness in this country cuts across race, it cuts across gender, it cuts across age, and younger people are beginning to, again, self-report, are beginning to identify themselves as grappling with mental health in higher and higher numbers. In some surveys that we're seeing, right, from Pew Research, for instance, when surveyed and when asked, teenagers and young adults are increasingly likely to identify mental illness as a primary concern for people like them, people in their generation. We know that historically, right, for many people, and certainly for African Americans, there have been many barriers to mental health services, mental health care, the stigma associated with mental health, lack of sort of knowledge and understanding about what mental health is, and of course, financial constraints in terms of just inadequate or limited financial resources to seek out appropriate care. We also know, right, that the number of Black psychiatrists and Black mental health care workers is significantly dwarfed by the increasing demand of Blacks needing those kinds of services. And so there's oftentimes this kind of cultural mismatch. And that is to say that African Americans, for instance, not being able to access therapists, not being able to access mental health care workers that are able to offer, right, the kind of cultural competency, the kind of racial sensitivity, knowledge, and awareness that becomes an increasing, an important part of how they pursue and find their path to wellness. In my own work, you know, as someone who studied young people in their relationship to technology for well over a decade and a half now, I've always been struck by the inventive ways in which young people have adopted technology, particularly younger African Americans, as one example. And here's some research by Vicki Rideout, who has done a lot of work, survey work with first with the Kaiser Family Foundation, and more recently with Common Sense, where she and a colleague basically surveyed young people between the ages of 14 to 22. And what their study found is something that essentially kind of reaffirms, you know, work that I've been doing over the years, and that is the degree to which young people are increasingly turning to digital platforms, increasingly turning to social media and online technologies to pursue their health and well-being, building community, fostering conversation, lowering those barriers, right, to people understanding mental health, creating, right, conversations and vocabulary that allow people to grow their knowledge, and more importantly, I think, beginning to diminish some of the stigma associated with mental health. And so while we've seen, right, as a result of COVID, this acceleration of telehealth, this acceleration of people turning to these systems and turning to these technologies to get access to care, what we've known for some time, particularly among younger people, is that they were already doing this pre-COVID, right? That they were already sort of recognizing at least the potential that these systems offered in terms of a refuge, in terms of a community, in terms of this sort of structure of support that is critical to people finding their path to wellness. And so we've been working on a project, a digital project, sort of the design of a platform based on about a year and a half of research. And we actually started this research again prior to COVID, emerging. And so because we sort of knew, right, that young people, for example, were migrating towards digital platforms. We could see right through social media that they were engaging in conversations, they were sharing information, creating hashtags and creating communities around mental health in ways that we found that not only destigmatized, but again, built these structures of support that allowed them to find resources that otherwise may have been difficult for them to find access to. So as we think about those questions that are being asked in good systems around can we design technology in ways that advance rather than undermine racial equity, here are just some of the things that we've been thinking about in the design of the system that we're creating. And for example, how can we use data and how can we use AI and other kinds of technology features to match users with relevant content and relevant specialists? Again, one of the big challenges, one of the big barriers is that people can't find access to those who they have a sense of connection to, feel as though they can find dignity and respect from the interactions with them. And so how might we engineer and design systems that facilitate the ability to make those connections and to match people in ways that, again, support their wellness? We also know, right, that through a variety of AI and machine learning systems and technologies, that the ability, right, to analyze language, right, is becoming significantly enhanced. So the ability to analyze the content that people are posting on social media, the words that they're expressing, the emotions that they're articulating, the pictures and visual content that they're sharing, we are now seeing systems that are being built that allow us to do large scale kinds of analyses of those kinds of data. And I'm curious, right, if we were beginning to start combing through Black social media, Black Twitter, for instance, Black Instagram, for instance, how might we begin to understand, right, how young people are using these systems to talk about mental health? What are they saying about mental health? What are they looking for in terms of what they need to find support regarding mental health? And it seems to me, right, that designing these systems in ways that might be able to do that, right, with greater frequency, with greater accuracy, is something that becomes, increasingly important. And one of the challenges that we're finding with artificial intelligence and why it's so flawed, typically speaking, is that the kind of data sets that are oftentimes being used to build these systems, if it's facial recognition, or if it's other kinds of technology systems related to the kinds of systems that law enforcement, for example, are using, what we're understanding, right, is the input, right, the data that goes into those systems, that goes into building and driving those algorithms, are oftentimes flawed. They oftentimes, right, aren't relevant, right, to Black people's lives, and therefore either misrepresent them, don't represent them at all, or represent them in ways that oftentimes lead to potential harmful outputs and decision-making processes. And so one of the challenges that we're finding, and one of the challenges that we think this creative future is creating more and more of a need for, are data sets that are more culturally relevant, data sets that are less biased in terms of their design, in terms of their structure, in terms of the information that it allows us to generate as a result of having access to those kinds of data sets. Now, there are all kinds of challenges associated with these systems, and let me be clear. I'm not making the case that technology by itself is the savior to Black life post-COVID. In fact, what I'm arguing, right, is exactly the opposite. That it's going to require people asking new kinds of questions. That it's going to require people bringing new kinds of skill sets, new kinds of abilities, new kinds of critiques, new kinds of understandings of both past, current, and future forms of systemic racism, to understand, right, how these systems may be designed, how they may be leveraged, how they may be engineered in ways to advance racial equity. These technologies won't do it by themselves. These technologies won't do it by companies in which Black and Latinx people are poorly represented in terms of the workforce. And it's going to require other means, other mechanisms, other ways of generating the kind of, both the kind of cognitive capacity, but also, right, the mindset and the disposition and the desire, right, to have these kinds of impacts. And so I see that as being the most significant opportunity and one of the more significant barriers. So less of a technical barrier per se, and equally more of a barrier in terms of just bringing in people with different lived experiences, people who are able to look at and see the world through a different lens that might allow them to begin to start thinking about how these systems might be used, again, in ways that advance rather than undermine racial equity. So there are all kinds of challenges. There are ethical challenges here. in terms of how you deal with people's privacy, how you deal with people's data. Misinformation is something that we all have to contend with, and research is beginning to suggest that African Americans have to deal with toxic kinds of misinformation. If it's information about race, if it's information about presidential elections, if it's information about the vaccine, right? How we are, in some ways, our communities are being deliberately and intentionally targeted with misinformation to undermine the quality of our lived experiences and life chances. And so those are all challenges that I think that certainly define this world. And then finally, let me end with another project that we've started. And all of this work is happening, by the way, in part through the Institute for Media Innovation, which is a new kind of academic and design research I'm helping to create in the Moody College of Communication at UT Austin. So in partnership with the Institute, in partnership with Good Systems, we've recently been having conversations with the city of Austin about its adoption of what we might call smart technologies. We're hearing more and more about this concept of smart cities, right? Cities that are data-driven, cities that are incorporating, right, these intelligent systems more and more into their day-to-day operations. But what we've come to understand, right, is that as these systems are being more deeply incorporated into how cities function, how police departments work, how transportation systems work, how public health resources are allocated, and how public health systems work, how educational systems work, that even as these systems are becoming increasingly influenced, right, by technology, increasingly influenced by what we might call the datafication of everyday life, to what extent, right, are the managers of these departments, the managers of these systems, thinking about racial equity, thinking about the racial and equity implications of these technologies? And what we're learning, not surprisingly, this is not unique to Austin, this is in fact, I think, more representative of cities around the country. And as a result of an event that I was a part of last Friday, cities around the world are grappling with these challenges, right? And so how do we begin to think about the equity implications of wide-scale technology adoption? This is one of the questions that we're asking. And again, how can these systems be adopted and deployed in ways that advance equity rather than undermine equity? Because the truth is, right, what we're learning is that most departments simply aren't asking these questions, and they're not doing this out of any type of desired effort to undermine the quality of working people's lives, the quality of the Latinx population's lives, or the African American population's lives, but rather it just never occurs to them to sort of think about, right? Well, the systems that we're using, right? What kinds of data have gone into the design of these systems? What kinds of decision-making processes are these algorithms making? And how do we know for a fact, right, that these algorithmic decision-making systems, that these automated decision-making systems aren't producing, well, we know that they're producing outcomes that have these disparate impacts, right, in terms of race, in terms of ethnicity, in terms of gender, in terms of income. But how do we begin to create systems that challenge that re-engineer that, right, that audit and help us to better understand how to rewrite those systems in ways that don't lead to these disparate outcomes? So this is a larger project that we hope, as we engage in conversations with other locations, with other cities who are also grappling with these circumstances, how do programs and how do departments and how do cities staff themselves in ways that allow them to grapple with the fact that these systems, if they're not careful, if they're not intentional, can in fact replicate racial discrimination and bias, can in fact undermine efforts or attempts to create a more racially equitable community or city. And so going back to this notion of creative futures, part of what I'm asking myself and our team and the city players that we're talking to are what kinds of skills and mindsets will be required, right? As we think about this future, right? As we think about the kind of creativity and ingenuity that will be a part of building this future world, rethinking how these systems can be used in ways that support our desire for greater racial equity, rather than undermine our desires for greater racial equity. And so that suggests, right, that the kinds of skills that we'll need, how we prepare people to develop those skills, who we prepare to have those skills, will become some of the more notable challenges, if you will, of the 21st century. And so when I think about creative futures, I think about the ability, right, to build teams, to build cognitive capacity, to build expertise, to leverage lived experience, and to leverage diversity, right, and inclusivity as a way to inspire and drive change in a way that we find leading to greater racial equity, greater racial opportunity, and greater if you will, peace and mobility in the lives of all Americans, and particularly those who find themselves on the social, economic, and political margins. So I'm going to stop there and just open it up for any questions, thoughts, or reflections. But I just wanted to give you like a sense of some of the things that I've been working on, some of the questions that I'm thinking about, some of the research that's informed those questions, and how I'm thinking about Black life in sort of a post-pandemic future, and why creativity, ingenuity, innovation are going to be critical parts of that future. And so I'll leave it at that. I'll stop sharing my screen and open it up for questions. Rhonda, or I don't know how you want to proceed. If there were, I know there were some things in the chat and some other.
Yeah. So I'll read the questions just so that you don't have to curate. So again, thank you first very much for such a wonderful talk. And I think really helping to flesh out sort of like what it means to kind of think about data and think about systems as well, and to think about sort of how systemic racism is sometimes unintentional, or thoughtless, and how we have to be intentional about that. So I'm going to start with the questions that we have. I already see some questions in the Q&A. If you have more questions, please feel free to type your questions out in the Q&A, and I will be sure to ask them. So the first question is from one of our fellows, Francine Allen. Thank you for this insightful presentation. In terms of African-American youth and other minority youth who may have greater familial and financial resources, is there evidence of those resources shielding them from weathering and the inequities intensified by COVID-19? Or is systemic racism overriding their resource advantages?
Yeah, and I'm just beginning to kind of probe this literature, but my sense is that even when you account for the class distinctions within the African American community, that these effects of weathering are still appear to be evident. So suggesting, right, that even in cases where African Americans may have access to greater financial resources, I mean, and we all know this, right, that it doesn't shield them from discrimination. It doesn't shield them from racism. And in fact, there's some research that suggests that in some ways, right, they get exposed to other forms of racial discrimination. Particularly, right, if they are perceived as a threat, right, for certain kinds of occupations, for certain kinds of things that bring status and privilege and opportunity, that they oftentimes, they being African Americans, can find themselves facing, right, discrimination, find themselves facing mistreatment as a result of these kinds of challenges and inequities. And so again, I think at least my early sort of reading of the literature is that even across socioeconomic status, that African Americans aren't completely shielded or protected from these weathering effects that researchers are beginning to find.
Thanks. The next question is from Edgar Randolph. Can you speak to the intersection of the new economy and the old economy in accessing health resources and determinants of health in the pandemic? So for example, in Atlanta, there are Facebook pages that facilitate vaccine access in North Georgia. People in Atlanta with access to the internet, the ability to navigate the web, and a car can access the vaccine anywhere in North Georgia. However, people in Atlanta without access to the internet, the ability to navigate the web, and a car cannot access the vaccine across town.
Yeah, that's a great question. And in fact, we just my team here just put together a proposal that in part, I think makes the argument that's being made here that we're at a point where we can certainly expand the social determinants of health. And this question to me implicates technology, right, as an increasing topic, if you will, for thinking about these determinants. So we've oftentimes historically thought about the so-called digital divide. I think we're increasingly sort of recognizing, right, that there's this data divide as well. And so the sort of implications for equity, right, health equity are quite striking. And they manifest themselves in a variety of ways. The great example that was just shared here in terms of people who have access to not only access to the internet, right? But what we found is that access to the internet by itself is not enough, right? It's what some call the skills gap. In other words, right, being able to cultivate the kinds of skills and literacies that allow you to engage in what we might call capital enhancement, enhancing your social capital, those that you're connected to, your informational capital, your financial capital, your educational capital. And what we're seeing, right, is that there's certainly disparities there in terms of being able to leverage and use the technology in those ways, which suggests, right, that at least for some, right, that not only the lack of access to the internet, right, but also the lack of opportunity to cultivate these different forms of capital and skills that allows one to successfully navigate the internet are unevenly distributed as well. And so what I'm seeing too, right, is even when I've talked to medical health professionals, right, who are doing telehealth, for instance, and they talk about the sharp contrast between their patients, right, who are in homes with broadband and reliable broadband and hardware that's updated and software that's updated that allows for potentially a much more fluid telehealth experience vis-a-vis those, right, who may not have access to broadband or trying to do this right through a smartphone that may or may not have the functional capacity to support a productive and fluid telehealth experience. There's huge discrepancies in terms of how these technologies and how the digital and data divide sort of impact people's ability to use these systems to enhance their health. And then just one other thing really quickly, one of the things that I try to push back against in my own research, and both in the Digital Edge book and also in Don't Knock the Hustle, is the increasing importance of not being sort of limited in terms of how we historically have defined the digital divide. And so we oftentimes think of the divide when we think of African Americans, for example, as oftentimes in terms of what they lack, right? They lack access to this or that. They lack access to these skills or to these resources. And while certainly, right, in terms of access to broadband, in terms of access to educational opportunities are significant, salient, and important, what we also have to understand and factor into that equation, right, are what are the assets that African Americans bring to their engagement with these technologies. They bring ingenuity, they bring motivation, they bring aspiration, they bring community. We see this, right, in Black Twitter. We see this in Black Lives Matter. We see this in various other illustrations of how they have sort of basically adopted these technologies and deployed them in ways that suggest, right, the ability to sort of think creatively, the ability to understand, right, how these systems can support and address racial equity issues. And so my point is, we also have to think about not only the liabilities, right, or the weaknesses that are oftentimes associated with African Americans in technology, but what are those incredible assets and resources that they bring to their ability to navigate these systems as well.
Thank you. So the next question is from my colleague, Beretta Smith-Shomade in Film and Media Studies. Oh, so you know Beretta. Thank you for your engaging and necessary work. I may have missed it at the beginning, but do you feel like the actual access to technology is less important or less an issue than it has been in the past for Black and Brown communities? So as you think about mental health services, for example, are the algorithmic concerns more the issue than actual access?
Yeah, absolutely, Brett. I think you're exactly right. And this is something that I began to start seeing, over a decade ago, and why I was so interested in doing the research that we did for the Digital Edge, because I knew that the narrative that only sort of imagined Blacks, right, as lacking, as insufficient, as not able to sort of navigate these systems. I knew that was a significantly limited perspective, and I was just sort of seeing and experiencing, something that was completely different from that. And so you're right. Access, it's not that access is no longer an issue, but it's perhaps less of an issue than it was 15, 20 years ago. Smartphones, for example, have sort of opened up access to the internet, put the internet in our hands and in our pockets in ways that we could not have imagined 15 to 20 years ago. And yet there's still some questions and challenges with that if your only gateway to the connected world is via a smartphone, particularly if you're a student, right? And we hear a lot now in the research about the quote unquote homework gap and some of the challenges, right? If students only have a mobile device, trying to do a homework assignment via a mobile device presents significant challenges, right? It's not impossible, but it presents significant challenges. The point, Beretta, that you're alluding to is it more a question now of access, or is it more a question about the nature and the quality of that access, particularly to the extent that the quality of our experience with the internet, the connected world, is increasingly and emphatically shaped by these algorithmic decision-making processes. And what we're learning, right, through the work of Sophia Noble and certainly others, is that these systems are oftentimes designed in ways that replicate, magnify, accelerate, and scale bias and discrimination in unprecedented ways. And so it's our increasingly our ability to sort of think critically about these systems. So data and digital literacy expand in multiple kinds of ways now, in new directions that we're only beginning to comprehend, and that our schools, quite frankly, aren't even really thinking about in terms of K through 12, for example. And so the challenges become much more deeper, and they become much more systemic, much more complicated than mere access, right? So providing someone access to the internet, providing someone access to broadband doesn't mitigate, right, the likelihood that they are to encounter misinformation, the likelihood that they are to encounter and experience algorithmic decision-making processes that oftentimes undermine, right, the mental wellness, the information that certain populations have access to, and how we need to engage in ongoing efforts, ongoing critiques, ongoing practices that ultimately sort of rebuild these systems, rethink these systems, and redesign them in ways that sort of recognize, right, their current racial and gender liabilities.
Thank you. So this question is from one of our fellows, Barbara Combs. Thank you so much for this talk and for your larger body of work that so poignantly addresses the overlapping nature of racial oppression and the ways that this contributes to continuing racial inequality in society. I was struck by your comment about how people deserve an education that prepares them for a rapidly changing economy. Can you speak a little bit more about that? Specifically, I'm trying to get at the distinctions along race and class lines that existed before COVID, and how those might be magnified in a post-COVID society.
Yeah, that's a great question, and we addressed that, in the research that we did for the digital edge, and that was that was a 1.5 year long ethnographic study where we spent time on the ground in the school, both during the school day and then after school, what students were doing, like in their sort of digital media clubs and things of that nature, access to them at home, their parents at home, the household environment, the neighborhood environment. And so, as you can imagine, right, and as we all know, right, it is a complicated situation, and yet what I found myself thinking about over and over again through the research is that schools have essentially over the last 20 to 25, and I'm talking K through 12 here primarily, have essentially focused on, almost when it comes to technology, sort of one singular mission. And that is basically just to acquire more and more and more, right? And the big tech platforms and technology education have sort of fed that notion that you build a better school, you build what I call a future ready school by consuming more and more technology, making more and more technology available to your students. And so what has occurred is just the circumstance that we noted, and that other researchers have referred to as classrooms and schools that are technology rich, but curriculum poor. And what we mean by that, right, is that oftentimes, right, at the risk of over embracing this race to technology, schools really haven't thought adequately about what it means to learn with these systems. What kinds of skills are actually required, the kinds of questions that we should be asking our students to develop, the kinds of cognitive capabilities that we should be creating environments and opportunities for our students to develop. And it goes back to this idea, right? And again, I'm being somewhat facetious, right? But a world in which either your skill is a complement to the machine, and you find opportunity because you know how to ask interesting questions, to inquire about this, to design that machine, or to work with others to design opportunities and problem solving kinds of designs that leverage the capacity of that machine to do some interesting and novel things? Or are you on the other side, right, where your skills are increasingly just being replaced by the machines, right? Manual labor, certain cognitive tasks that machines are able to do much more effectively than humans. And so it boils down, right, to sort of helping young people develop not only, right, what I would call the mindset or the cognitive skills to operate in a world like this, but even like just the disposition to know, right, that in this new world of work, this new economy that's emerging, right, it's very likely, right, that I'll cycle through, 10 jobs over the course of my career. That this idea of working for one company or one organization for 30 or 40 years, for most young people, that'll never happen, right? And so it fundamentally requires a different mindset, a very different disposition, and what I would call a kind of entrepreneurial or sort of creative mindset. And I don't mean entrepreneurial in the sense of going out and making money, but entrepreneurial in the sense of being able to identify, right, where there may be opportunities, where there's a problem, and how I can work with others to come up with a solution, to come up with a concept, to come up with a model to address that problem. That those are the skills that are becoming increasingly valued. Those are the kinds of things that machines, at least as far as I know, and what a lot of the research that I've seen suggests, that humans are just simply better at doing those kinds of things than machines are, right? So a machine might be able, take crowdfunding, for example. So you might be able to use Kickstarter or use GoFundMe or some other, crowdfunding platform to raise a lot of money. And so the machines facilitate that, make that more accessible, scale that to people all over the world. But machines by themselves don't have the recognition or the capacity to understand that they can be used in that way. And that's human ingenuity, right? That's humans deciding that here's a problem, right? Getting access to capital, getting access to financial resources. Here's a tool, here's a platform, here's a resource that if used, right, in a certain kind of way to address a certain kind of problem, then you begin to sort of see where I'm going in terms of this notion of creative futures. And part of what we're arguing, right, in the book, In the Digital Age, is that our schools, as they are currently constituted, simply aren't built to help young people develop those kinds of skills. And this is especially the case, right, in terms of lower income schools, especially the case in terms of the schools where African American and Latinx students are attending, that those schools are significantly less likely to be in a position to help young people develop those kinds of skills and that kind of disposition, of what I call just way of being in the world, and sort of recognizing that this is the world as it is, and these are the kinds of things that I'll need to be able to do in order to find opportunity and life chances in this world.
Thank you. So Barbara has a second question. I'm wondering if in your recent research you have seen the social media habits of minority change. I'm reminded of how Darnella Frazier recorded George Floyd's killing, but it also victimized her and continues to haunt her. Do you have any predictions about how this important outlet of video for recording Black trauma can also be a force of continuing trauma and victimization?
Yeah, that's a great question, and we were we were thinking a lot about this in those interviews that we started doing with young adults, and it's maybe some of you have seen the Netflix documentary, The Social Dilemma. And in that documentary, right, they talk a lot about these sort of what we might call persuasive technologies, right, or the ways in which these systems are sort of engineered and designed to persuade us, right, mainly, right, to keep interacting with the system, to keep using Facebook, to keep using Instagram, to keep using Twitter, to keep using YouTube, whatever the system is. And they're engineered in ways, right, if it's the content that they flash before you, if it's the ways in which they rank content and information that you see, it's all designed, right, to keep you coming back, and some would say to keep you addicted. And so this raises questions, right, about what we are exposed to. It raises questions about what goes viral. And for a number of young people that we talked to, right, and this wasn't just unique to young people, and it wasn't just unique to young African Americans, for instance. I think this is increasingly becoming the case for more and more of us, is finding ways to strike a balance with the social media world in which we find ourselves a part of. But the idea that tomorrow or next week or next year that social media will be eliminated, that's not happening, right? People are not giving up their social media. Social media is sort of deeply implicated in many aspects of our lives. I would argue for young people that social media is deeply implicated in virtually every aspect of their lives. And so the question becomes, how do we help them, and how do they begin to better understand ways in which they can exercise more control over the system, as opposed to the system exercising more control over them? And so when it comes to this question of trauma and this question of exposure to content that is traumatizing, this is a real issue, right? And this is part of the dilemma, because I think on the one hand, if you look at Black Lives Matters, right, and I talk about Black Lives Matter, I talk about other young Black creatives in Don't Knock the Hustle, in terms of how they have used technology, I think, with great ingenuity, with ways that build community, that foster community, that expand opportunity, that provide resources to learn things and to cultivate and pursue aspirations in ways that, quite frankly, simply would not have been possible without the benefits of social media. And yet at the same time, we know that these same tools, we know that these same systems are exposing African Americans, right, to toxic information, to carefully calibrated and very intentional misinformation campaigns. If it's undermining our access to information about the vaccine, if it's undermining our access to information about, our elected officials and different policies, that there are real challenges out there. And so how do we both help people to develop, right, the skill and the capacity to discern misinformation from higher quality information, resources that are more likely to traffic in misinformation or disinformation, compared to resources that are less likely to traffic in that kind of content, and equally important, how do we work with these technology platforms to recognize the traumatic aspects of some of the content that circulates online? And so many people, for instance, just told us, right, that particularly after the sort of viral transmission of the horrific murder of George Floyd, that they simply just had to take a break, right, and that they simply had to unplug, turn off the social media, in some cases delete an account for a temporary period of time, just to find sanity, just to find peace, just to find a path to wellness. And so it's a striking dilemma, right? That the technologies that enable us to gain access to each other, access to information, access to networks, access to opportunity and creative aspirations, that these same systems, right, are also being deliberately used to undermine our health and our well-being as well. And so this is all part of this broader conversation around digital wellness and digital literacy that I think takes on some really interesting features when you talk about African Americans.
Thank you. So this question is from Gerald Brantley from Emory Libraries. What can be done to leverage corporations, big businesses, and law enforcement to be more cognizant and sensitive to ethical artificial intelligence sensitivity?
Yeah, no, that's a timing question, and in part that's one of the projects that I mentioned. I didn't get a chance to elaborate, but it's something that we're doing now with the city of Austin. We're working with the equity office in the city of Austin to essentially develop a toolkit, what we're calling a technology equity toolkit. We'll develop that toolkit, which is essentially intended to allow each department to begin to do a kind of internal assessment of its performance along a number of different indicators related to equity, in terms of the systems that they procure and purchase, for example, to how effectively or how deliberately are they evaluating those systems and understanding the potential for bias and discrimination in those systems. I think your question is striking, because it suggests, right, that the work that's required to do this is quite substantial. And even as we often, when we talk about digital literacy, right, generally, right, in the circles that I've been a part of over the last decade and a half or so, oftentimes focus on young people, students, and helping them develop, right, the literacy and the capacity to better understand the implications of these systems, to better deploy these systems for social good and benefit. But what we're also understanding, right, is that adults, right, and people who are charged with managing these systems, building these systems, purchasing these systems, and deploying these systems, that there's a significant amount of literacy work that needs to be done there as well. And so I say part of it, right, is trying to figure out opportunities to have conversations with people in government, with people in business and industry around these issues. I mean, because of, I think, the advocacy, because of community activists, because of, Black Lives Matter, beginning to point out some of the deficiencies and some of the limits in these technology systems, these corporations, these industries, and even, government agencies are now being forced to grapple with the ethical and political aspects of these technologies. And quite frankly, right, these are questions that they would not be considering. These are issues that they would not be addressing if community activists and technology activists weren't compelling them to do so. And so I argue, right, that change is never going to happen internally, right? A Google, a Facebook, a Twitter, whomever the big or even small tech platform is, internally, right, they simply just aren't built to ask these questions and to pursue answers and generate solutions for these. But once you begin to find activists, once you begin to start, advocating for change, demanding change, doing research that illustrates the need for change, you begin to start making a compelling case that industry and government officials can no longer sort of turn a blind eye towards. And they have to begin to start addressing these issues, not because they necessarily want to, or because they internally have decided that this is something that we should do, but because they've been compelled and forced to do, right? If that's through popular agitation, public demonstration, hopefully increasingly right through regulation. But these are the primary levers of change. And again, I suggest, right, that all of it is going to emanate from bottom up as opposed to top down.
Thank you. I want to see if there are any more questions. Gone through all the ones that I've been given. Okay, let's see, give it one more minute. In the meantime, I want to thank you, Dr. Watkins, for such just a wonderfully provocative and talk. So we're very happy that you could be here. I wish that you could hear the applause, but I know that it's happening. I see one more question. It was just a word of thanks. So I want to thank you again for being a part of our presentation. And I hope that those of you who are here will come back next week and bring a friend with you. Our speaker next week is Legina Goss of the University of California, San Diego, and she's going to be talking about legislative behavior following protests. So with that, I wish everybody a good afternoon, and we will see you next week. Take care.